The whole journey's just been point after point. It's this thing of you've got your eye on the next kind of milestone to go after. And yeah, for us it was, we knew that we had a prototype that was ideally suited to massively parallel computing. We knew, in theory, if we put that on the cloud, that would make things usable in the operating room. So the very first thing was to get that first bit of seed funding to go and build that prototype. And you know, with that, you're then actually aiming to do this with real healthcare data. So it's doing it all in the context of a clinical trial. So for us, it was probably that bit. It's that first kind of getting going of getting the money to do the first prototype and to show that you can actually deliver this in the health system.
For cancer specifically, about 1/3 of cancers can be prevented purely from behavioural and lifestyle changes. So prevention is a huge piece. And one of the things that we'll look to do with the technology is actually connect data to look at how we can influence behaviour. And digital technology is actually absolutely amazing because if you look at all the technology you use every single day, Facebook, WhatsApp, Instagram, or even if you use games, elements of that gamification, going back to the app to use it and incentivizing behavior, to be able to translate that to health apps and be able to influence people to make small changes to their lifestyle or their behavior, which can make translational real difference into preventing predictable health diagnoses to them is huge. And I think both in the sense of maybe with you, with people who are at risk, and same with people who might be at risk of cancer, we would be able to identify them really early on. So analysing data sets and using technology more creatively and intuitively to see what your behavioural patterns are and activities are and things like that to tailor it to you.
I think that's what we'd hope, definitely, that it would become widely used, and because it is so readily available, as, like you said, nearly everybody has internet now. The only thing is, I suppose our limiting factor is that the fetal fibronectin test itself and also the transvaginal scanning equipment is expensive. And in low-income settings, there isn't often provision for these things. And also, in terms of the use of the app in this country, it would be for things like knowing whether a woman is enough at risk to keep her near a tertiary centre where we can deliver tertiary level care in NICU units for preterm babies. But we hope that, you know, as care of preterm babies improves in developing countries, there will be these tests will be able to become more readily available, and the care that we can offer will become more relevant to those places too. So that's a kind of longer term vision, yeah.
One of the things that I've had my eyes open to massively, and it touches on that last question, you know, last week at a conference in the US about health information, 43,000 people attending and absolutely massive displays by the companies. Nobody's trying to do this stuff on their own. The big buzzwords are cloud and interoperability. If you're getting data, or if you've got an app, or you've got some system out there, it's being able to talk with all the other bits and pieces going on. So the electronic health records, the analytics. You know, even the massive companies like IBM and Microsoft and Oracle and Siemens and whoever, they're not doing it on their own. They're all using bits of different technology, building it together, getting the data from where they need to get it, and getting the insights out from it. So we are just seeing the very beginning of that.
I think one of the big trends that was initially alluded to, the whole concept of personalized medicine, where it becomes the relationship between the doctor and the patient, where the patient will see you now. So that whole focus shifting towards what the patient wants in terms of the data that's available to him is much more powerful than how it is currently. Now, looking ahead within the next 5 to 10 years, one of the big trends that's emerging is artificial intelligence, machine learning, and blockchain. So this is something that's come from the financial sector, where consumers will be in charge of their own data in terms of financial transactions. And the same thing can be applied to a healthcare setting, where patients will have that information about their own records, which is accumulated through wearables and different digital technologies. So ensuring that it's encrypted, that it's protected, and has the securities that are applied with the financial sector, as I mentioned. Blockchain is definitely something that I see the whole personalized medicine movement going to.
Sandra, do you want to comment?
So this is a massive thing for us. So when we spin up our clouds for this, it's often in a different country from where the operation is going on. And what it comes down to is, what data do you need to do the job that you're doing, that you're contracted with the hospital to do? We don't need to process the patient's name or date of birth, those sorts of pieces, but that does need to be attached to the data when it goes back into the operating room. So there's a huge amount that happens in the architecture that you have, and then when you have what's called pseudonymized data, where the identifiers have been taken away, there's no way you can go back and identify that patient. That's then the data that you can do the deep learning, the machine learning, the artificial intelligence stuff with. But it's a massive, massive area in itself, and it's a matter of doing the right stuff with the data that you get and being sure that you're compliant with it. And the agencies are out there. They do everything on us, from penetration testing to random audits to check that we're complying with all those all the regulations around it.
So the way in which Health Makes Space works, it's essentially a networking platform. So sort of like a Match.com for techies and doctors. And on top of that, I know you mentioned about the messaging features through WhatsApp, etc. That protected environment that we have through Health Makes Space makes it that ever more pertinent, as following on from the last question about ensuring that healthcare-related data, patient information is kept on official platforms. The issues with WhatsApp and more broadly Facebook, or discussing patient information, which I think you were more focusing on, is obviously it has its downsides in terms of how protected is that information. But the way in which we focus on is actually making those connections. So if there's a cardiologist, if there's a technologist who's making a blood pressure monitoring app, and he needs that insight from a cardiologist, he'll find him, and they'll both work together to actually develop an app which is useful both in a clinical setting for the cardiologist to use, but as well as for the patient, so that they're aware of their own information, their own data, so that it's useful for all the parties. Because one of the big problems that we're facing right now with the technology sector, not just in the NHS, but in other countries, is that a lot of waste is involved in these brand new apps that come out, which most of them never see the light of day because of the fact that they weren't built with a clinician in mind. They weren't built around the patient. So by actually involving all the stakeholders from an early stage makes that product much more viable.
If you look at the Apple sales of iPads over Christmas, one of the biggest sale reasons for iPads were actually for carers and children of elderly people, buying them to help with communication. So a lot of the elderly generation actually communicate with their children and their relatives both within the UK and internationally via iPads and tools. And as we see more and more people having care delivered in their own homes or nursing homes or residential homes, we see increasing people being responsible for elderly people, so carers as well as other dependents. And there is more use or scope to use technology when offering care to those people. So they might not be using it directly, but they'll be benefiting from it indirectly, and there's a huge space around that at the moment.